So my presentation was part of the inpatient gastroenterology boot camp for advanced practice providers, so nurse practitioners and physician assistants. There were 4 talks in this block, and they all included diagnoses that you may encounter working in an inpatient GI consultant type setting. So my talk specifically focused on bowel ischemia, diverticulitis, and small bowel obstructions. For each of these diagnoses, I went through and reviewed the epidemiology, the pathophysiology, the typical presentation that you might see when the patient is coming in with this. What diagnostic evaluation would you be considering in terms of, potentially blood work and imaging, and what the typical treatment options would be, and then the ongoing monitoring and any potential follow-up that would need to happen in the future. Yeah, I think it's really important to go back to taking a really good history. I think that's critical to trying to figure out what is going on with the patient. And a lot of the questions seem pretty straightforward, but you don't want to forget to ask them. So things like, when did the pain start? Is this, a new pain that has just started relatively recently, like today or in the last few hours? Or has it been going on for a long time and maybe it's suddenly worse and that's what's prompting them to seek evaluation? Where specifically is it located? So we have different organs in our abdomen, and depending on where the pain is at, may give you some clues as to what might be involved. What have they found makes it better or worse? Just to give an example, sometimes things like moving, if that makes pain worse, it can actually more relate to like a muscle issue than an actual organ issue. So it's helpful to know what they've noticed. What symptoms do they have associated with it? So besides the pain, are they experiencing anything else, such as nausea, vomiting, diarrhea, constipation, fever? If it's been going on a long time, have they lost any weight? Any like what we would call alarm symptoms, like blood in their stool, black stool, vomiting blood? And what have they done so far, either in terms of like self-treatment, trying to manage at home, or have they already seen someone for this and maybe had some testing or some type of treatment recommended, or are they just coming in now and nothing's been done? But just trying to get a really good history of kind of what the story with the presentation has been. You do have to individualize to the patient. For these 3 specific disease states, I would say CAT scan or CT scan of the abdomen and pelvis is probably the most prominent, but there are definitely others that could be considered, such as abdominal x-rays. You can do different types of ultrasounds, and you can do what's called a CT angiogram or conventional angiogram to look at blood flow. Probably not the first test that you're going to do for any of these things, but you may want to consider also some type of endoscopy, whether it's an upper endoscopy or a colonoscopy. I would say most of these patients are probably, for the diagnoses I had, presenting to the emergency room or being, directly admitted to the hospital for these concerns. So most commonly, probably a CT scan is what you're going to be looking at. I think it's important when you meet them and you get through your history and your physical exam, just to explain to them kind of what your thought process is and what the potential diagnoses are that you're considering based on the information that you have so far. And then just explain to them, I'm thinking that you may have this, or, maybe there's some potential alternative diagnoses that you may have. And this is the testing that we typically do for that, whether it's blood tests, imaging, and then kind of once you have those results, circle back to them, explain, what's been found on the testing, and if you're able to make an official diagnosis at that time, or if there's anything else that's now needed, and then what treatment you would recommend, and get their input onto, what they think about the treatment plan, and, help them through any questions, or maybe consider alternatives if they have reservations. It's important to know, when you need to call a consultant. So I think oftentimes gastroenterology is called for a lot of abdominal complaints, but we need to know, when something is progressing to needing a surgeon or when we need someone else to help with the management. So I think first and foremost, just knowing when you need that help. And when you're calling that person, what are you specifically asking them? Are you asking them, like, I think this person needs to go to the operating room. This is urgent. Or are you just asking for an opinion on the management? So being very clear in, who you're involving, why you're involving them, what you're hoping to get out of that consult, and then just making sure that everyone is on the same page, updating throughout the care, on what the plans are, making sure the patient's been updated and the whole team is kind of on board and aware of what the plans are. No, I think the talk was really great in terms of just going over some things that APPs might not be as familiar with, but frequently encountering in the hospital setting and trying to take a stepwise approach to reviewing what those different diagnoses look like and what the potential plans would be for those patients so they can have a solid foundation to start seeing and hopefully effectively treating these people.